Good afternoon. Welcome to the Vanderbilt University School of Nursing 2024 Investiture and Celebration. I am Dean Pam Jeffries, Dean of the School of Nursing, and I have the honor of leading and presiding over today's events. Seeing so many graduates, families, friends, faculty, and preceptors here for this festive occasion is a pleasure. Investiture is always an exciting, momentous event as it marks the accumulation of hard work, the acquisition of new knowledge, and the recognition of new roles and opportunities for our graduates. This year's ceremony is particularly momentous as we will award degrees to our very first class of Masters of Nursing graduates. Yay! These students joined us in January 2023 in our new generalist nursing program. They have successfully completed 4 semesters of a demanding new program and are now preparing to take the NCLEX exam and start their careers as registered nurses. We are so proud of them. Congratulations, MN graduates. Today's ceremony has drawn graduates, family, and friends from around the nation. Because Vanderbilt University only holds one commencement ceremony a year, those gathered here include our August 2023, December 2023, and May 2024 Master of Science in Nursing and Doctor of Nursing Practice graduates. Therefore, some of you just finished your classes and degrees while others have returned to participate in the investiture. I am delighted to see all of you and welcome you back to campus. Like you, I have been looking forward to celebrating this day and your many achievements for some time. Commencement is a joyful occasion marking the completion of all your hard work. Hours of study, months of classes, long days of clinicals, and many late nights of writing papers or presentations, as well as offering official conferring your degrees. So today, you're here as a culmination of all you have worked so hard, surrounded by family and friends who cheered you on, and your faculty and classmates who are beaming with pride as the nursing professionals you have become. We are delighted to be part of this important day. As befitting a nursing school founded for many a century ago, today's ceremony will be full of tradition. Some may wonder why Vanderbilt calls its graduate ceremonies commencement and investiture. Commencement celebrates the completion of degrees, whereas graduation is the completion of all the degree requirements. Investiture refers to the formal and public act of conferring authority of symbols of high office. At Vanderbilt School of Nursing, it is when we formally award the symbols of your academic accomplishments. In this case, the academic hoods in Vanderbilt, gold and black trimmed, and the apricot representing the nursing discipline, to acknowledge your acquirement of knowledge and authority as masters and doctorally prepared nurses. This ceremony is symbolic, marking of your passage from student to graduate, and with it, conferring your responsibility to our nursing profession and those you serve. University investiture ceremonies date clear back to the Middle Ages, as do the academic regalia we all wear today. The elaborate academic robes represent the gowns faculty and students wore, indicating they were scholars. When universities granted the honor of an advanced degree to its scholars, they adopted the hood as a symbol. The hoods signified the pursuit of scholarly and professional achievements, were designed with distinguished colors for each school or a particular discipline. The investiture hooding ceremony began in medieval times. The graduates being honored would come before the head of the university to receive a hood from their faculty. In bestowing the hood on the student, the faculty acknowledged that the student was no longer a student, but instead a fellow academic, a master. Soon, you will come forward to receive your hood from the academic director of your specialty or program. With the placement of the hood, your deans, academic directors, and faculty confirm that you have completed the academic and clinical training for your degrees. Congratulations on your very great achievement for earning them. Now, I would like to introduce Marilyn DeBree, Executive Chief Nursing Officer for Vanderbilt University Medical Center and VUSN's Senior Associate Dean for Clinical Practice, who is also a Vanderbilt nursing alumnus and unequaled friend of the school. Marilyn?
Thank you, Dean Jeffries. Good afternoon, graduates, family, and friends. It is my great pleasure and honor to be with you today and to be part of your investiture celebration. Each of you has accomplished something very significant and very important. Congratulations and thank you. Nothing makes an alumnus happier than to know that the students who came after them continue their alma mater's tradition of excellence. Thank you for choosing Vanderbilt and being the future of the school and the nursing profession. I've been a nurse my entire professional life, and I have to say that it is the most fulfilling, challenging, and wonderful job in the world. As advanced practice nurses, you are at the forefront of healthcare. Not only will you provide individualized patient care, but you will also educate, innovate, and advocate for the health and well-being of patients, families, communities, and populations. I'm so glad that you've entered the workforce, both as a nurse myself and as a representative of healthcare. You and your fellow graduates are vitally needed in nursing today. We've all heard of the nursing shortage and the silver tsunami, which sees baby boomer nurses retiring just as the baby boomer generation needs more health care. With your advanced knowledge and abilities, you've been equipped to help meet patient needs and to find new solutions for issues in our society today. The School of Nursing's emphasis on evidence-based practice, clinical skills, and problem solving has prepared you to provide exceptional patient care and advanced health care. My education at Vanderbilt prepared me to do many things, from providing patient care to being a nurse educator and eventually to becoming a nurse leader for a major academic medical center and health system. Your Vanderbilt education has prepared you for similar opportunities, including those we may not even know about yet. We live in an evolving, challenging, and complicated world. Fortunately, you've selected one of the top institutions for your education. You're prepared to deal with evolving, challenging, and complicated situations and issues. In closing, as an alumnus, I encourage you to stay connected to Vanderbilt, your cohort, your faculty, and the school itself. One of the things that has helped me professionally and personally has been maintaining ties to the Vanderbilt University School of Nursing. I can recall consulting with my former faculty, and even to this day, I remain close to many of them. You can attend lectures and events to expand your knowledge. You can precept, help with reunions, speak to classes, or mentor students. Staying connected has helped with my own growth and development over the years, and it's allowed me to give back. I encourage you to do so as well. You and your career will be richer for it. Thank you for choosing nursing, and thank you for selecting Vanderbilt. On behalf of the Vanderbilt University School of Nursing alumni, and most importantly, the individuals you will serve, congratulations and best wishes. And now I welcome Dean Jeffries back to the podium.
Thank you, Marilyn. Your words, staying connected Vanderbilt, are wise and valuable. I echo Marilyn's words and encourage you all to keep in touch with VUSN and your fellow classmates. I spoke earlier about our origins of the academic regalia and the history of our ceremony today. Now I would like to talk about another tradition, not as old, but one that dates back to 1877 and the founding of Vanderbilt University. Each year, Vanderbilt awards a gold medal to the top scholar in each of its 10 schools in honor of founder Cornelius Vanderbilt. This year, Teresa Cagle, a Doctor of Nursing Practice graduate from Atlanta, Georgia, is the School of Nursing's Founders Medalist. Dr. Cagle, will you join me? Dr. Cagle embodies the hallmark qualities of a Founders Medalist: top grades, innovative scholarship, exceptional practice, and service to her family, patients, and community. Teresa's path to Vanderbilt and to her doctorate degree can be credited to her drive and her passion, and perhaps to her legacy. Teresa says she comes from a nursing family. Both her grandmother and aunt were nurses, as are her nieces and daughter-in-law. Teresa began her nursing career by earning an associate science degree in nursing and working as a surgical department RN. Then she paused to focus on her family. She raised 3 sons before returning to nursing, both as an emergency department RN and as a student earning her Bachelor in Nursing Science and Master in Nursing Science, both from Georgia College and State University. She didn't stop there. Newly certified as a psychiatric mental health nurse practitioner and starting a new job as a mental health provider, Teresa began working on her doctorate of nursing practice here at Vanderbilt. Teresa has dedicated her scholarship and now her career to being an advocate for mental health care. Her DNP project dealt with patient safety for those prescribed medication for depressive disorders. Her quality improvement project included analyzing the effectiveness of pharmacological guided approach to medication management. Pharmacogenomics, the study of how a person's genes impact their response to drugs, is an essential component of personalized medicine. Research has shown that patients' reactions to the same medications vary vastly. Teresa practiced as a psychiatric mental health nurse practitioner at McIntosh Trail Agency in Georgia, which provides mental health, development disability, and addictive disease services to underserved communities in Metro Atlanta. Her agency has implemented her DNP project and adopted additional tools that make it easy for healthcare providers to request gene drug test from a patient's electronic health record. This helps to ensure that providers are prescribing medications that are best for each patient. After earning her DNP, Teresa has also begun moving toward another goal, that being of an educator of nurses in the mental health area. She will start precepting students from Emory University's nursing program as in discussions regarding serving as a clinical instructor. She is committed to educating more nurses who can assist in meeting the nation's growing mental health needs. Teresa is determined to treat patients with the highest level of evidence-based care and to mentor and educate students as she continues to advocate for mental health care, quality, equability, and safe patient care. Teresa, I am proud to present you the 2024 Founders Medal for the School of Nursing. Here, come on over. So yesterday at graduate day, Teresa received her Founders Medalist along with the other 9. And I want to do a shout out. Her 93-year-old grandfather, I don't know where he is, but he's here to see her. Before we move into the hooding portion of our investiture ceremony, I would like to recognize some other distinguished members of the VUSN class of 2024. This first group of graduates who are active duty military or veterans. We respect and value the service provided by our veterans and perspectives they bring to our programs. Their life experiences, leadership abilities, and critical thinking make them outstanding classmates and students. Would all those graduates who are veterans or active duty personnel please stand so we can recognize you? We thank you for your service to the country as well as to your choice to pursue nursing as a profession. For some of our family and friends here, our nursing traditions and symbols are unfamiliar. You may wonder why this purple cord I wear represents what it represents. It signifies that the person wearing it is a member of Sigma Theta Tau, the International Honor Society for Nursing. Sigma is a long-established and respected organization focusing on scholarship, leadership, and service. To be invited to join Sigma, graduates, nursing students must have completed at least 1/4 of their program and have a 3.5 GPA. Graduates, if you are a member of Sigma Theta Tau, would you please stand and be acknowledged, and faculty or other members also stand. Congratulations to all of you. Such an honor. Finally, there is one more group I am delighted to recognize. VUSN has an outstanding and a selective PhD in nursing science program for nurses who desire to transform the discipline of nursing through scientific discovery. Students come across from the country to study with our faculty and develop their scholarship and research areas. They have been members of our VUSN community for several years, coming to campus for intensives and events before embarking on their scholarly careers. At Vanderbilt, PhD degrees are conferred by the graduate school rather than the individual schools like the School of Nursing or College of Arts and Science. Earlier today, at 11 o'clock, the graduate school held a separate commencement ceremony during which new PhDs received their doctoral hoods and were recognized for their significant accomplishments. This year, we have 7 stellar nurses who earned PhDs in nursing science degrees from Vanderbilt. I will ask Assistant Dean Angela McNeilis will have the privilege and honor of introducing them to you. Dr. McNeilis.
Dr. Rosalind McNeish DeLisser, whose study is titled Work Environment, Psychological Safety, Burnout, a Mixed Methods Exploration of Nurse Practitioner Experiences. Dr. Krista Harch, whose study is titled The Effects of a Medication Adherence Mobile Application Among Medically Underserved Patients with Chronic Illness. And Dr. Jennifer Rivas, whose study is titled The Impact of Organizational Factors on Appointment Scheduling Wait Time in U.S. Primary Care. Family, friends, and other honored guests, please join me again in acknowledging Vanderbilt's 2024 PhD in Nursing Science graduates. Now I ask Dr. Terry Allison, Director of our DNP program, Dr. Mavis Shorn, Senior Associate Dean for Academics, and Dr. April Capu, Associate Dean for Clinical and Community Partnerships, to come forward to present our Doctorate of Nursing Practice graduates.
Dr. Terry Allison, Assistant Dean for Academics and Professor, will hood the graduates of the Doctor of Nursing Practice program. Dr. Grace Oluwakemi Akinbe, whose project is titled Usefulness of a Written Cardiometabolic Monitoring Tool. Dr. Erin Sable Alexander, whose project is titled Evidence-Based Mental Health Screening in an Infertility Clinic. Dr. Michaela Ashton Phillips Besham, whose project is titled Evaluation of the Current Naloxone Administration Process in Vanderbilt Psychiatric Assessment Services. Dr. Julia Binko, whose project is titled Heart Failure in Primary Care, a Gap Analysis of GDMT. Dr. Sarah Lynn Bloom, whose project is titled Development of a Quarterly Scorecard for the Adult Respiratory ECMO Program at VUMC. Dr. Hans Joseph Breitbach, whose project is titled Assessing the Nurse Practitioner Role in Air Medical Transport Teams. Dr. Gregory Robert Buckingham, whose project is titled A Descriptive Analysis of Burnout in Registered Nurses Working on Medical Surgical Units at Franciscan Health, Indianapolis. Dr. Teresa Cagle, whose project is titled Utilization of Pharmacogenomic Testing in Depressive Disorders. Dr. Meredith Trowbridge Caldwell, whose project is titled Development of a Toolkit for Nurse Manager Retention and Job Satisfaction. Dr. Margaret Louise Cecil, whose project is titled Leadership Development Impact for Physicians and APPs. Dr. Angelina Jeanette Cante, whose project is titled Nursing-Based Financial Reimbursement Utilizing National Provider Identifier Numbers. Dr. Robert Bruce Conway, whose project is titled Assessment of Psychiatric Mental Health Nurse Practitioner Competencies. Dr. Catherine Elizabeth Curtin, whose project is titled Back to the Basics, Implementing Pressure Injury Bundle to Reduce the Incidence of Pressure Injuries. Dr. Fe Virginia Del Casol, whose project is titled Anesthesia Perioperative Consult Service Providers' Perceptions of the Electronic Patient Reported Outcomes Measures Implementation. Dr. Taylor Marie Dodd, whose project is titled Depression Screening at the Time of Admission to a Cardiac Intensive Care Unit. Dr. Alexis Lauren Glassman, whose project is titled Emergency Department Nurse Comfort Caring for Psychiatric Patients. Dr. Leah Michelle Hagan, whose project is titled Workplace Violence Simulation Training. Dr. Brooke Amber Hazen, whose project is titled Designing an LGBT+ health screening toolkit and algorithm for primary care providers. Dr. Elizabeth Leffert Huggins, whose project is titled Advanced Practice Provider Perceptions of Opioid Prescribing Feedback. Dr. Patricia Ann Knudsen, whose project is titled Implementation of a Standardized Breastfeeding Assessment Tool. Dr. Shani Todd Landgraf, whose project is titled Staff Perceptions of Q15-Minute Patient Safety Observations in Inpatient Psychiatric Settings. Dr. Priscilla Ann Marble, whose project is titled Structured Contraceptive Counseling for Alaska Native American Indian Women at a Primary Care Clinic. Dr. Kristen Elizabeth McCook, whose project is titled Implementing Gatekeeper Training for Suicide Prevention. Dr. Catherine Elizabeth McDaniel, whose project is titled Creating Pediatric Mental Health Access in a School-Based Health Center. Dr. Hannah Rose Merriman, whose project is titled The Impact of EFAS POCUS Training on the Confidence and Proficiency Levels of Aeromedical Nurse Practitioners. Dr. Veronica Miguel, whose project is titled Assessing Prescribers' Perceptions of a Quiz Time Learning Module. Dr. Mark Daniel Miller, whose project is titled Examining the Attitudes, Perceptions, and Beliefs of Advanced Practice Registered Nurses in Tennessee related to full practice authority. Dr. Stephen Lee Miller, whose project is titled Heart Failure Optimization, Pulmonary Artery Pressure Monitoring, Utilization, and Implementation. Dr. Carrie Alice Morgan, whose project is titled Primary Care Providers' Knowledge and Attitudes of State-Issued Newborn Screening Fact Sheets. Dr. Ted Morris Jr., whose project is titled Enhancing Medication-Assisted Treatment Utilization to Combat Opiate Use Disorder. Dr. Nancy Jean Muldowney, whose project is titled, Does Educating Providers on Advanced Directives Make an Impact on Competency and Completion Rates? Dr. Henry Uchina Wosu, whose project is titled, Reducing the Incidence of Pressure Injuries in Skilled Nursing Facilities. Dr. Lindsay Elizabeth Reap, whose project is titled Emergency Event Electronic Debrief Initiative. Dr. Tashara Naila Reed, whose project is titled A Patient Awareness Emergency, CKD to ESRD and the Unaware Patient. Dr. Sylvia Robinson Nichols, whose project is titled Implementing Practice Change, Utilization of Quick Parenting Assessments Within Vanderbilt Outpatient Pediatric Clinics. Dr. Tanya Solonik, whose project is titled Nurses' Perceptions of Barcode Medication Administration Workarounds. Dr. Bonnie Klutz-Sammons, whose project is titled Understanding the Benefits of Therapeutic Music in the Community Setting. Dr. Nicole Lynn Scraw, whose project is titled Optimizing Fill Volume of Blood Cultures Submitted in a Children's Hospital Emergency Room. Dr. Nicole Elizabeth Taylor, whose project is titled Inpatient Benzodiazepine Detox, Evaluation of the Central Nervous System Depressant Protocol. Dr. Fabiola Vences Alvarado, whose project is titled Outcomes of a Wellbeing Toolkit to Mitigate Perioperative Nursing Staff Burnout. Dr. Patrice Monique Walton, whose project is titled Educating Patients on Current Health Technology Using the Teach-Back Method. Dr. Deanna Lynn Womble, whose project is titled Resilience in Pre-Licensure Nursing Students. Dr. Allison Zamitis, whose project is titled Addressing Barriers to Treating Pregnant Patients for Syphilis, a Qualitative Approach in Tennessee. Dr. Lauren Elizabeth Zilka, whose project is titled Education on Trauma-Informed Care in the Clinical Setting. I'd now like to welcome Dr. Brian Widmar, Assistant Dean for Academics and Associate Professor, who will now acknowledge our Master of Science in Nursing graduates.
Dr. Sharon Bryant, Academic Director, will hood the graduates of the Adult Gerontology Acute Care Nurse Practitioner Program. Michael Rush Bissett. Brandy Nicole Crawford. Danielle Danielle Denise Farley. Megan Day Hightower. Paru Gautam Patel. Veronica Lee Rawlings. Kennedy August Vorwaller. Hannah Marie Wood. Dr. Melissa Hayes, Assistant Professor, will hood the graduates of the Adult Gerontology Primary Care Nurse Practitioner Program. Nicole Monique Arrington. Christiana June Barbato. Sabrina S.A. Andrea Hill. Adeline Michael Holzman. Tracy Ann Hunt. Elizabeth Cassandra Kingma. Lydia Koski. Sarah Elizabeth Lansden. Dr. Julia Steed, Academic Director, will hood the graduates of the Family Nurse Practitioner Program. Amaria Asgar. Veronica Bernaba. Sarinya Reddy Budamgunta. Caroline Grace Chance. Elizabeth Celeste Gilly. Carlisha Simea Moraney. Kimberly Morgan Riley. Shaukat Youssef Shehata. Brianna Faith Sullivan. Akia Janae Thompson. Dr. Jennifer Wilbeck, Academic Director, will hood the graduates of the Family Nurse Practitioner Emergency Nurse Practitioner Program. Harrison Ross Wright. Dr. Colleen Moss, Academic Director, will hood the graduate of the Neonatal Nurse Practitioner Program. April Taylor. Dr. Kendra Fawcett, Academic Director, will hood the graduates of the Nurse Midwifery Program. Eunice Vanessa Morales. Kiera Norman. Pamela Allison Rutherford. Dr. Kendra Fawcett and Dr. Julia Steed, academic directors, will hood the graduates of the Nurse Midwifery Family Nurse Practitioner Program. Julie Patricia Grijalva Bailey. Lanice Henry. Selena Wakely Petchek. Catherine Ruth Thomas. Anastasia Benia Woods. Dr. Debbie Arno, Academic Director, will hood the graduates of the Nursing and Healthcare Leadership Program. Melanie Crystal Cohen. Catherine Ann Daknewski. Dr. Patricia Singstack, Academic Director, will hood the graduates of the Nursing Informatics Program. Carissa May Decker. Lisa Marie Roddy. Dr. Kim Stinson, Academic Director, will hood the graduate of the Pediatric Nurse Practitioner Acute Care Program. Blaine Christopher Gordwine. Dr. Brittany Nelson, Academic Director, will hood the graduates of the Pediatric Nurse Practitioner Primary Care Program. Catherine Marie Abley. Alyssa Claire Bednarik. Caitlin Adair Freyu. Kristen Arcadia Hughes. Summer Street Richardson. Rachel Janelle Rupert. Stephanie Lynn Watson. Dr. Rose Vick, Assistant Professor, will hood the graduates of the Psychiatric Mental Health Nurse Practitioner Program. Suman Chung. Cody Elizabeth Hecker. Public Health Interrelated Nurse Practitioner Program. Jadia Lanesha Anderson. Olivia Layton Hazley. Haley Elizabeth Puckett. Marina Salee. Please welcome Instructor Raven England Joyner to the podium to acknowledge the first inaugural class of the Vanderbilt University School of Nursing Master of Nursing graduates.
Dr. Mary Ann Jesse, Assistant Dean for Academics and Professor, will hood the Masters of Nursing graduates. Sophia Margaret Berryhill. Sarah Lauren Byers. Rachel Yuan Lee Trick. Shannon Natalie McLaughlin. Sarah Grace Patton. Kendra Kiera Phillips Lowry. Crystal Chi Ritchie. Ellie Kate Roberts. Ashley Kathleen Strouser. Morgan Olivia Taylor. Taylor Ann Webb. Helena Naeem Yakub. And now I would like to welcome back to the podium Dean Pamela Jeffries, who will give her final remarks.
Thank you, Raymond. As I said earlier, can we give everybody a hand? Wow! As I stated earlier, commencement is the acknowledgement that graduates have completed all the requirements for their degrees. It is also when degrees are officially conferred. As the Dean of School of Nursing, I have the honor of presenting our students who have earned the degrees of Master of Nursing, Master of Science in Nursing, and Doctor of Nursing Practice. Can you all stand, all the graduates? The requirements established by the School of Nursing and, on the recommendation by the faculty, have been conferred that the academic degree on behalf of Vanderbilt University Chancellor Daniel Diermeyer, I hereby confer your degree. Yay! I present to you the Vanderbilt University School of Nursing class of 2024. What a special day. Thank you. All right, you can sit down. We'll summarize here. Today is the culmination of months and years of hard work and sacrifice by you and your loved ones. You came to Vanderbilt seeking knowledge, experience, and advanced degrees. You could have selected an easier path, but you didn't. You chose to learn at Vanderbilt University School of Nursing, where rigorous academic and clinical standards are the norm. You chose to learn from Vanderbilt's world-class educators, clinicians, and researchers. Now, you are ready to take your place as nurses with advanced degrees, responsible for delivering unsurpassed patient care, and as nurse clinicians, bringing evidence-based practice and knowledge into improving healthcare outcomes. As Vanderbilt nurses, you know that there are large and complicated challenges facing healthcare in our country and around the globe. They include provider shortages, health disparities, societal issues, limited access to health services, unmet mental health needs, and the rising cost of care, just to name a few. Yet, I am optimistic about the future of healthcare because of you today. There are 359 new Vanderbilt Master of Science in Nursing graduates taking their places as nurse practitioners, nurse midwives, nurse leaders, and nurse informaticists. There are 60 new nurse leaders who have earned their Doctor of Nursing degree today. There are 7 nurse scholars with new PhD in nursing science degrees starting careers advancing the discipline and practice of nursing through research, education, and health policy. And because of today, there are 30 new Master of Nursing graduates educated and prepared to join the workforce. I am optimistic about the future of healthcare because of you. All the members of this class, MNs, MSNs, DNPs, and PhDs, have many things in common. You have excellence, dedication, intelligence, accomplishment, and hard work, to name a few. Today, you have joined over 13,000 Vanderbilt School of Nursing alumni worldwide to make a difference in healthcare. You will make a difference to your patients and their families, your co-workers, employers, the workplace, and our nursing profession. You will change lives. You are Vanderbilt's answer to society's healthcare challenges, not because you're so very needed as providers, but because each of you is a nurse leader, equipped to ask the hard questions, identify the problems, find the best solutions, discover knowledge, and lead the discussions that will revolutionize healthcare delivery. As you go forward as providers, nurse informaticists, nurse leaders, nursing faculty, nurse scientists, and doctorally prepared nurses, I urge you to be confident and patient-focused. Embody compassionate care. Seek out problems to solve. Advocate for your patients and your profession. Keep learning. Embrace science. Be bold in your ideas and creative in your implementation. On behalf of our deans, our program directors, our faculty and staff, I would like to take a final opportunity to congratulate you. You have put tremendous work and passion into the accomplishments we celebrate today. You're an extraordinary group capable of making exceptional contributions to healthcare. Vanderbilt's stated mission is to bring out the best in humanity, and I have faith that our wonderful educators have prepared you to meet that challenge. Wherever your journey leads, know that Vanderbilt School of Nursing community commends you, wishes you well, and takes pride in all you do. Thank you. So this concludes our investiture ceremony. I invite all of you graduates and guests to join us over to the reception to celebrate your significant accomplishments. Our faculty will recess out first, followed by our graduates. Please wait for the recessional to finish before you go to the reception tents on my left. Thank you again, and congratulations, class of 2021.